Now, the Sekyere East District is plagued by neglected tropical diseases, and now it is emerging from the shackles of this burden. Now, in 2023, health officials identified cases including 2,471 of scabies, 22 of lymphatic filariasis, including 7 deaths among children due to rabies. These findings spurred a proactive response involving case search management, collaboration with stakeholders, and teacher training. Mahmoud Mohamed Nuruddin reports that these efforts are yielding positive results, restoring and saving lives. Let's watch this and have a conversation afterwards.
Meet Daniel Sabatei, a resilient 51-year-old farmer at Edukrom whose fields, once full of promise, now echo with silence. Daniel, who has 6 children, faced adversity when his supportive wife passed away in 2020. The loss brought numerous challenges, compounded by his current struggle with leprosy.
I began to observe unusual changes on my hands shortly after my wife's passing. Concerned about these changes, I sought medical attention, leading to a diagnosis of leprosy. This revelation has left me feeling desperate and increasingly anxious. I am engaged in farming activities, particularly in cocoa, maize, and cassava cultivation.
According to Daniel, his sickness has impacted his ability to provide for his children's education, a responsibility he once managed well.
Prior to my challenging experience, I dedicated considerable efforts to my work, meticulously weighing my cocoa beans and generating a profit of 4,000 cedis. However, it is now disheartening to see that the farm's income is insufficient even to cover the wages of laborers, let alone provide for my own needs and those of my children. His inability to wheel a cutlass and work because of his leprosy has significantly disrupted our educational pursuits. As a result, we have had to return to the village to assist him, ensuring that he can provide for the family's needs, especially the education of the younger ones. One of the challenges I face on my farm is the uneven distribution of cocoa plants, leaving certain areas empty. I am seeking assistance to fill those vacant spaces. This improvement is anticipated to boost my overall yield and subsequently increase my income.
Well, let's discuss how this progress can be sustained. Dr. Emmanuel Teviu is Deputy Director of Public Health in the Ashanti region. He's joining us for this conversation. First, let's understand the dangers of the neglected tropical disease.
Yeah. Good morning, Aisha. Thanks for having me. First of all, I want to say that I'm standing in for my regional director who should have been here, but due to other competing assignments, he asked me to stand in.
Right.
Very well. Yes. So, yeah, as you could see in the just a summary of the documentary, the neglected tropical diseases are a serious public health problem, considering the fact that they result in disability, which also affects the socio-economic status of the affected persons. And so it's not only a health problem, as you see, but it also contributes or has a very huge effect on the socio-economic well-being people who would have otherwise contributed to the economic development of the country.
Now, let's understand the progress that we've made so far. I want you to share that with me.
Yeah, so we, as a region and also with Ghana Health Service, we continue to look for cases in the various communities. The thing about these NTDs, as we call them, is that they are not very dramatic. In other words, most of them are not acute. They normally come slowly, but create a very bad effect later. So we have our district health directorates teams at the community level searching for cases, and when they get those cases, they link them to care and provide treatment for them. Also, we have normally we do what we call mass drug administration in various communities, where we target the population and give them medication to be able to treat and cure the causes of these entities. So a lot of progress has been made as a country and also as a region, as you can see in this documentary. It was through the active efforts of the health workers going into the communities. Some of the communities are hard to reach, poor communities, to be able to identify these cases so that we can bring them to the limelight and also treat them and make sure that their health is restored and then they are able to continue their economic activities.
How do you intend to sustain these efforts?
Yes, so we do this in collaboration with various partners, both local and international. Normally, you have to engage the communities to be able to mobilize them. And so it's a continuous process of searching for cases in the various communities. Already, we have an existing health system structure up to the community level to be able to identify and pick up these cases. And so we'll continue to build capacity of our health workers so that they can be able to identify these cases. Also, we are using the approach of all of society approach, where we think that communities must be mobilized very well. Communities must be aware that these cases exist in where they live, and they should stop stigmatizing people with these NTDs and hiding them and give them access to healthcare workers so that we can continue to link them together. So we'll continue to collaborate with partners. In this documentary, you see that the Member of Parliament was very instrumental. The traditional authorities are very instrumental. We also have other religious leaders, traditional leaders, all coming on board to support in ensuring that we look for the cases where they are, and then we bring them to treatment so that we can sustain the gains and make sure we control and eliminate these entities in our communities.
Dr. Emmanuel Tevio, I'm grateful for your time. He's Deputy Director of Public Health in the Ashanti region.